Hi everybody, my name is Dr. Martinez and I'm a naturopathic doctor at PhysioChiro Wellness. Today I've prepared a presentation about eczema because I have many patients with eczema and also many people ask me about what a naturopathic doctor can do for somebody with eczema. So first of all, let's talk about some of the quick facts regarding eczema. So right now in Canada, we have approximately 8.5% of children aged 6 to 7 and 9.4% aged 13 to 14 who suffer from eczema, which is quite significant. And approximately 1% of adults have eczema here in Canada. 1 in 5 Canadians are affected with it at some point in their lives. And the worldwide prevalence ranges from 5 to 20%. And interestingly, it's highest in developed countries. And the annual cost of it to the Canadian healthcare system is around $1.4 billion a year, which is really significant. So what can we do to help people with this? Okay, so next let's talk about what some of the causes and or risk factors are. So as I mentioned earlier, it tends to be more prevalent in developed countries, particularly in urban environments. We're not 100% sure why this happens, but one of the theories is what we call the hygiene hypothesis. And that basically just means that we're very clean in these areas of the world. We tend to want to sanitize everything and keep children from playing in the dirt. We're sanitizing our hands all the time and sanitizing our children's toys. So that might be one of the reasons why we tend to see this. Why is that important? We need to be exposed to various bugs to build our immune system. And eczema is part of what we call the allergic triad. So it has to do with an allergic constitution. So if you are exposed to bugs, you build your immune system and therefore you don't have this type of constitution. Also, it can be genetic. So if the father or the mother have a history of what we call atopic disease, and again, that just means any kind of allergic constitution, that actually is one of the biggest factors. So if mom had asthma or allergies, we might see a baby with eczema. Also, we know that exclusive breastfeeding can be protective for somebody developing eczema in the future. And a vitamin D deficiency. This might also be why we tend to see it in some developed countries more, because we tend to have colder climates with less sun exposure. So that could also be an explanation. So let's talk about some of the things that go wrong usually, some of the physiological changes that are present in somebody with eczema compared to somebody who doesn't have it. So basically, as I mentioned, we see that the immune system is going towards an allergy type of response. There's also a deficient skin barrier, and the skin microflora, or the different bugs or bacteria that we naturally have in our skin, is different between somebody with eczema and somebody without it. And we also tend to see more inflammatory markers in people who have eczema. So what are the naturopathic options that we can offer? First, I'd like to focus on lifestyle implementations that may be simple and cost-effective for people. So one of the main things that I talk about is just limiting the amount of hot water that is used, and at least try finishing your shower with cold water. The reason why I recommend this is because with really hot water, you tend to open up the pores in your skin, and so your natural oils just kind of dissipate. But if you use cold water at the end, you're closing your pores and therefore retaining those great natural oils that we have in our skin. And therefore, you end up with less dry and irritated skin. Of course, moisturizing right after a shower or a bath. And by that, I mean with a natural moisturizer. So I always recommend to my patients that they choose natural, gentle body care products that don't contain synthetic fragrances, no harsh chemicals. And also, as much as you can, go scent-free, even with natural essential oils. For some people who are just very, very sensitive, that might be an issue as well. Also, choose gentle products for washing your clothes and cleaning your house. Some fabrics, such as wool, may also aggravate the itching. And avoid allergens and irritants such as tobacco, dust mites, mold, pollen. I also am a huge fan of oat baths. Many of my little patients' moms love these as well. They definitely see an improvement in these. And usually I recommend to just place a cup of oats in a coffee grinder so that you bring it to a powder. And then you can place them in a Tide cheesecloth. And then you would place them in a warm bath and just soak there for about 20 minutes. And then you can just pat the skin dry. Choose the right moisturizer. So one very popular and really helpful moisturizer is just plain natural virgin coconut oil. There's some evidence that it decreases the risk of staphylococcus infection, which we can see in people with eczema. If there's enough irritation and enough cracking in the skin, that may develop an infection later. One word of caution though, coconut oil is not great for everybody. I have a few patients who actually get itchier after the application of coconut oil. So this is, again, just as reference. Finding the right one might be a process for some people. The other one that I really like is shea butter, cocoa butter, and herbal salves as well. Creams, ointments, and oils can be really helpful. Watching what you eat is really important, or what you feed your child. And what I mean by watch what you eat, this is specifically for mothers who are breastfeeding. If you are consuming a food sensitivity, then that might be contributing to your baby's eczema. So that's why it's important to identify these, or of course, identify your child's sensitivities as well if they're old enough. We know that they're linked to eczema, or at least to having more flare-ups of it. So the more common sensitivities include wheat, dairy, eggs, peanuts, soy, and tree nuts. The way that we identify food sensitivities, if that's something that we are going to focus on, is by two means. One is a hypoallergenic diet, and that is a diet that we discuss with you, and basically it involves removing the main allergenic foods for about 6 weeks, and then we start reintroducing one food at a time. If we see a flare-up when you've introduced that food, we know that that's a sensitivity. And then the next way of identifying a food sensitivity is what's called an IgG food sensitivity test. This is a blood test, so your naturopath would be writing you a requisition to go to the lab where they draw the blood and they send it off to the lab where they do the analysis of your blood. I'm also a huge fan of vitamin D. So checking for a vitamin D deficiency is important because it has been linked to a higher risk of eczema. In addition to oral supplementation, you can also make your own vitamin D cream by adding a whole bottle of vitamin D drops to about a 50 or 60 gram jar of aloe cream or another gentle fragrance-free cream of your choice. And that can be really soothing as well for the skin. Probiotics are also well researched when it comes to eczema, especially as a preventative measure. The specific strains of probiotic that you may consider are Lactobacillus rhamnosus and Acidophilus and Bifidobacterium. Some of my other favorite forms of therapy for eczema include acupuncture, homeopathy, gemotherapy, which is a form of herbal medicine, herbs, and of course stress management, especially with my adult patients who have eczema. We definitely see a direct link between stress levels and their eczema severity. So if you have any questions regarding anything that we've discussed today, feel free to call us or email us. And now our website has a chat function that you can use, and we are able to respond to your questions very quickly. Thank you, and I will see you next time.